Ledyard National Bank presents this special segment. Ledyard National Bank wants to congratulate Bruce King on the wonderful career serving his community. They thank him for his continued guidance and leadership as an integral member of Ledyard's Board of Directors.
I'm Laura James for YCN, and we're speaking with Bruce King, the CEO and President of New London Hospital. That's a lot to say, isn't it?
It is. It's been an honor.
It has been, and you've always been Bruce in the community.
Yes,
you
haven't
walked around saying, "Hi, I'm the President of New London Hospital."
I always say Mr. King is my father.
Exactly, and it's
staff.
True. But that has really formed the relationship with the staff, with the patients, and the community.
Right. Right. As we spoke in an earlier segment, this is a unique community, and it is something that I'll kind of share a story. When I came down here, I live in Hanover. I still had kids in high school. It was a 3-year contract, as I mentioned earlier. And the notion was, a lot of people in the community were like, "You're not going to move to the community?" And I kind of took that as a challenge to say, I'm going to be so visible in this community, people are going to not know that
They're going to be tired of seeing.
And I could run for mayor now in New London. I know more people here than I do where I lived for 33 years.
It's
so
true, and it's not been exclusive to the business community.
No,
You've really connected with the patients, with the residents. And
it's again a small community hospital. I mean, we have Rotary right here in this room.
Right.
That we host. I've been a member of for 16 years. Very involved in the college. Very involved in the school districts. It really is an opportunity. I'm going to Newport later this afternoon, where is another community, so there's 15 towns that we're servicing. And as you know, we even run the ambulance service for towns, which is unique.
Exactly,
and so
very
this
unique.
is really a hospital that is very connected to its community.
And it's funny because those of us who are New London residents and homeowners here in town, New London Hospital has just been a part of our lives. But it's been consistent and fairly seamless. But there is a lot that's gone on behind the scenes. So you arrived 16 years ago. Can you give us a framework for kind of how things have progressed as far as affiliations with Dartmouth, the Concord connections?
Sure. Against the listeners who have some historical perspective will recall there was about a 5-year period where there was a lot of transitional things happening in the late 90s, early 2000s, which brought my arrival in April of 2003. And I came here under a management contract. I continue to be a Dartmouth-Hitchcock employee. Within a couple of years, we joined what was then called the Dartmouth-Hitchcock Alliance, which was an organization of like institutions, including the Mount Escutneys and the Valley Regionals and so forth. And then in 2009, that organizational relationship changed and it was created something called the New England Alliance for Health. And I won't get into the weeds on the technical changes, but we, New London, and at the time Ian Holmes was my board chair, we said we really liked that relationship and we wanted to have a formal relationship with Hitchcock. And so we started and formed and framed and actually became the first affiliate of Dartmouth-Hitchcock Health that occurred in October of 2013. Now that, and followed a year later by Cheshire Medical Center, a year later by Mount Escutney Hospital, and as you know, last year, APD. And currently in the news is the Granite One relationship. So Catholic Medical Center, Huggins Hospital, and Monadnock Hospital are similarly looking to join Dartmouth-Hitchcock Health. With some pride, I can say that I was part of the foundation of the framework, the chassis, on which all of these relationships have come in subsequently.
It's funny, we're sitting here in the fall season looking at the trees, and we were the trunk. And then after that, it really blossomed after that alliance.
Right. We're the longest affiliate relationship going on, and we're entering our 7th year.
And how did that affect services and the status of New London Hospital?
I think it has been an anchor, and relative to other small hospitals. I mean, it really was fundamental in our foundation. We established a number of things. First, in terms of business relationships, our malpractice, our purchasing, a lot of sort of foundational things that are invisible to the patients. But as a standalone, it's more difficult than being part of a larger system. So we got better coverage, lower cost. And then, in addition, and something I'm very proud of, is we started to have clinical relationships. And so we have 22 what we call professional services agreements. And so things like oncology, dermatology, obstetrics and gynecology, women's health services, surgical services, orthopedic, neurology, you name it, we're actually buying a portion of providers My notion has been, why would a community go to the academic medical center? Why wouldn't we have the provider come to the community? And so for a lot of services, that's very doable. You know, we're not going to put a linear accelerator in for radiation therapy, but we can have an oncologist come here and help administer oncology.
You know, Bruce, I can just picture the parents who are listening saying, check, check, check. And having those services, right, brought to this community has been a real gift to the community.
Yeah,
as well.
and I get very frequent feedback to that extent. And what's been nice navigating in both spaces is that we don't have a 5-day need for any ologist, whatever you want to put in front of it, right?
Oncologist,
Cardiologist,
right.
oncologist. But we have a 2 or 3 day need, and so what we get to do is titrate the amount of, because I'm buying those services for this institution from the academic medical center, and so I take the sort of the economic risk of, but I want to have enough demand so that meets the merits of that expense. So.
And all the benefits for the local community.
Correct.
When we come back next time, we'll be talking to CEO and President Bruce King about some of those benefits to the New London community.